Hey all, Dr. Bachi here from Bodyforge Physical Therapy. Today I'm coming at you with 5 ways you can make the most of your physical therapy experience as a patient. My background is in outpatient orthopedic and sports rehabilitation, so your mileage may vary in other settings. However, I still believe that most of these points apply anywhere you go. Let's get into it. Oftentimes, especially with the current American healthcare system, it can feel like you're getting pulled around by your insurance company. When you get referred to PT, calling your insurance company is a great place to start, but that's just the beginning. They will tell you which clinics and therapists are in-network in your area, which means that they can take your insurance and charge you a copay, which will typically make your visits far more affordable. However, there are a few factors to take into account when you're deciding on which clinic to go to. In Miami, Florida, where my clinic is located, there are tons of places that are part of a chain. These clinics get a lot of heat for minimal one-on-one contact time and suboptimal results. It is right to criticize this flawed system. However, this is a product of insurance-based healthcare in America as a whole, and will take a whole other video to cover. The reality is, these places work because there are just so many people who need PT. If we didn't have all these chains, there would be month-long waiting lists, which is just not acceptable. If you're coming off of a hip or knee replacement surgery, or recovering from a fracture or sprained ankle, these places are going to work just fine for you. These sorts of patients are typically going to get better as soon as they're moving, progressing a little every time they come in, and not doing anything stupid to set themselves back. You may not fall in this category and may instead need specialized care. For stroke recovery, spinal cord injuries, Parkinson's, multiple sclerosis, and other neurological conditions, you will need to go to a facility that specializes in neurological physical therapy. As an athlete, you'll want to go to a place that specializes in sports rehab, and better yet, you want to find a therapist who has experience working with other athletes in your sport with similar conditions. Many specialists bring a number of resources to bear when curating the right environment and program for you to have great outcomes, which is why they often do not take insurance, as reimbursement can often be insubstantial. When you find a place like this, I would call them to see what their rates are and to see if that's something you can afford. As you might expect, evidence has consistently shown that one-on-one personalized care has better outcomes and patient satisfaction in fewer sessions than simultaneous or group treatment. In many cases, you end up paying less in the long run with a specialist, as you will have fewer sessions and a lower risk of re-injury and readmittance to medical services. Don't believe me? Shop around. Hit up a chain, and then try a session with a one-on-one clinical specialist and see if the difference is worth it for you. The most important thing at the end of the day is that you're satisfied that your needs are being met and that you're getting better. If these tips were in order of importance, this would have been in the top spot. To get better faster and reach those lofty goals that you've set for yourself, you must be consistent with your home exercise. Your therapist will love you if you follow the exercise program exactly as it is prescribed. Compliance is a little more challenging in PT because our medicine is motion, and motion does not always come easy. So when we get that patient who's full clearing their home exercises and comes in performing them perfectly as prescribed at the clinic, we get excited because we know this patient is going to do very well. Important caveat. In my experience, non-compliant patients fall into 2 categories. People that don't do their exercises and those that do way too much. Treat your home exercises like medication. Do it exactly as it is prescribed. You wouldn't quadruple your prescribed dose of Percocet and sprinkle in some of your cousin's Xanax in the mix just because the vibe felt right? And you can't expect to get better if you're not taking the medication that was designed and chosen specifically to help you get better. Do your home exercise. And be honest. What I mean by this is we're here to help, not to judge. If you haven't been on top of your exercises, we want to know why. Is it because it hurts? Is it inconvenient? Can't make the time? We need to know, because oftentimes we can find solutions to help you stay consistent. Be honest about how the injury happened and your past medical history. We didn't get into PT to judge people and poke fun at what you can't do. We are therapists because we believe everyone deserves a chance to get better and become that ideal version of themselves. If you hide information, this can only hurt you. And this is useful information for clinicians as well. Be honest with your patients. Sometimes they need to hear something from you that they won't like. It is your responsibility to give it to them straight so that they can make better informed decisions. Be honest and talk about how you're feeling and how the home exercises are going. Sometimes you'll feel like they're too hard or not challenging enough. You may not even know why you're doing something. Ask. We're here to help you reach your goals, and a big part of that is knowing what the heck is going on and why you have to do 100 plus quad sets every single day. As therapists, it is incumbent upon us to track your progress and note your status each time you visit with us. Some therapists are better about sharing this information than others, but you can make sure that you're kept in the loop by asking. We have to report on tons of objective data every time you visit, so we can easily fill you in on your progress. Back when I used to powerlift, trying to make the most optimal progress possible, I used to have a saying that if I didn't write my workout down, it didn't happen. There's some nuance to that, but the point is, if you didn't write down what you did today, how can you track progress and make informed decisions about future sessions? It's also helpful to see that all the work you're putting in is doing something. As humans, we love that feeling of progress. That's why we love reading books, watching TV shows and movies. It's that promise, progress, payoff cycle that gets your dopamine going. And that can be a valuable therapeutic tool. That being said, rehab is hardly ever a straight line to success. I'm fond of telling my chronic back pain patients that low back pain is kind of like the stock market. Some days are good, some days are bad. But as long as you're doing what you're supposed to be doing, overall you should be trending into the positive, and it's only a matter of time and effort before you reach your goals. If you're one of those people who have been in and out of PT due to chronic issues, please know that we are here for you. We know that this is not easy. In fact, we know it's extremely hard. This experience can be taxing, and you may have some rock bottom moments. In those moments, I want you to remember that there is no better foundation than rock bottom. You have everything to gain and nothing to lose. I know that these are just words, and I can't just tell you to be patient, to be resilient, to be persistent. The truth is, there is no easy remedy for that. It's a slow journey that begins with putting one foot in front of the other. If you stumble, take your time, but get back up. Resilience is a skill, something that you can learn and cultivate just like a muscle or a memory. Take this opportunity to build your resilience, and it will serve you well even after rehab is over. I hope that I gave you something to think about here, and remember that these little nuggets of wisdom are based on my clinical experiences. Of course, this list isn't exhaustive, and everyone's a bit different. If you have any tips to share that helped you along your path to recovery, please feel free to comment below. Everyone's journey is different, so don't be discouraged if you see other people improving faster than you, or if you're not running in 3 months like your doctor promised. You will achieve your goals in due time. Trust the process and try to follow these 5 tips. It can only benefit you. See you next time.